Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele, presenting Health Equity Teachers module addressing transportation barriers to health. So last presentation for transportation, we identified transportation barriers and how transportation barriers truly impact a patient's health in multiple ways. This module is now on how to assess patients for transportation barriers in a clinical setting and how to address those barriers in real time with local, state, and nationwide resources. So the objectives is that by the end, learners will be able to describe a provider's role in assessing patients for transportation barriers and how to do so, and identify resources with which you can connect patients in order to address transportation barriers and apply them in a clinical scenario. So just to begin with, why is this important? And we touched upon this in the last presentation with transportation, with how transportation enables a patient to get to their health appointments, to their treatments, to the pharmacies for timely medical care, timely medication access, and this truly allows for improved health outcomes. And this allows for prevention of chronic disease, uh, keeping the diseases that they're managing in check, changes to medication, um, everything with a patient's healthcare. They need transportation to these appointments, to the treatment. And so without it, with transportation barriers, we see poor health, health problems, as well as decreased attendance causing these health problems. Um, but we as providers have the power to change that. We have the power to connect these patients with the resources they need to combat their transportation barriers, to get around their potential lack of vehicle or transportation costs. And so the goal of this presentation is to teach you how to do that and how to prevent transportation barriers from leading to poor health outcomes with your patients and treating their health as a greater entity rather than just the conditions that they're experiencing medically. So step one is assessing the patients for transportation barriers. And how we do this is through screening, whether it's formal or casual, through just conversation. But what's important to understand is that currently studies show that there is a lack of transportation barrier screening. So this study looked at physician practices and hospitals and their screening rates for several social determinants of health, including transportation. So we see in this brown bar on the graph to the right um, that only 35.4% of physician practices were screening for transportation needs. And while hospitals, more hospitals were screening for transportation needs, not all of them were. Only 74% of hospitals screen for transportation needs. And this screening is a simple step that we can do that can lead to much better care for our patients. So we should start thinking about why aren't we screening and how we can get better at screening and how we can screen. So now we'll talk about what screening methods we can use to start being better with this. And where do we start? The patient history. Um, the social history component of a patient's history really gives us the opportunity to talk about the patient, who they are, what type of lifestyle they live, and this includes the transportation needs of this patient. So just you can casually ask them in the social history, how do you get around on a daily basis to different places, whether it's work, school, or activities? How do you get there? Um, you can also ask the patient, how do you get to the office today? And is that normally how you get to the office? These simple questions fit right in with the social history, and they'll give you a better insight of the patient's transportation needs and potential transportation barriers. And if you do get some insight into some potential transportation barriers, you can continue with some more specific transportation screening. And there's no formal universally recommended transportation screening like there are for some other screening for other diseases or conditions. But this is just a sample one that I've included in your module resources that I thought was assessed transportation barriers and needs really well and really simply. So a survey like this asks how they get to the office today, how long it took you to get there, and if this was how you usually got there, if it was a different way. Asking them to rate how difficult it was for them to get to the health center, as well as if they have, in fact, missed an appointment because of transportation barriers. And then it goes on to also ask whether the patient has vehicle access and a little bit more of some demographic information about the patient that could potentially be involved in some risk factors for transportation barriers. But again, a simple multi-question survey is a great way to get more detail into the patient's transportation needs and transportation barriers. But essentially, it's all about getting to know the patient and what they're experiencing currently so that you can address what they're experiencing. And another point with assessing patients for transportation barriers is assessing the patient's driving ability. And this is related to transportation barriers because if a patient can't drive and is unable to be responsible for their own transportation with a vehicle, then they're more at risk for experiencing transportation barriers because then they'll be forced to rely on others for their driving or rely on public transportation systems. So you should be able to assess patients for not only barriers to transportation, but their driving ability because that is involved in transportation. And this is especially important for patients who are of older age because we know that as patients get older, their physical abilities and cognitive abilities may be less intact. And those who aren't necessarily older, but may have a physical or cognitive disability. So some tools that you can use to assess this are looking at the driving regulations in your state. Does your state have specific driving guidelines that prevent people of certain abilities or disabilities from driving? And you can use this link here. It's included in your module syllabus, and we'll visit it later. And you can also use sample assessments to actually help you in real time assess your patient's driving ability with a small sample test that is specific to your state's DMV. So I provided the link for that here as well as in the module syllabus as well, which we'll get to. But these are some great tools to help you assess something that's sometimes ambiguous, this decision whether your patient can drive or not. And these can help you make that happen. So now that we've assessed our patient, their transportation needs and their transportation barriers, it's now time to address those transportation barriers. And we do this by really, again, starting with that conversation. We started with conversation to figure out what these needs were, and now we're going to continue that conversation to figure out how we can overcome these barriers. So you're going to want to acknowledge the patient's barriers that you've determined and really speak with them about how they're impacting the patient's life and health and why together you two should figure out how we can get around these and how we can better their ability to move and their ability to get where they need to go. And then once you introduce that conversation and get going together, you want to create a list of the places that they typically go. And again, I have the transportation mobility diagram on the right to remind you that patients go a lot of different places, not just to the health office. So you want to talk about where they need to get to so that you can have a comprehensive list of places that should be included when addressing their transportation barriers. And once you've determined their needs, you should explore different options for them to get to those places. That might be someone's personal contacts. Ask them if they've got family members, friends, or neighbors who can provide them rides or provide them vehicles, if they are still able to drive, to help them get where they need to go and help them establish those connections and have those conversations with those individuals. But you should also look elsewhere for these resources for transportation. And these might be local resources, state resources, or healthcare system based resources. And you really want to educate the patient on these different services and then determine what works best for them, based on where they need to go to. So local resources, some great ones that we'll walk through are 211. So this is a service that can connect you to many different resources, including transportation, and we'll use it to find local dial-a-ride services. Dial-a-ride are usually locally based, community-based transportation services for certain populations, whether it's populations of older age, of disability, or more. They're a local service for transportation. You can also look through the cities or areas' local public transportation options, because they might not be aware of them, and see if they are a viable option for this patient to be using. State resources can include non-emergency medical transportation services, and these would be exclusive to healthcare services, getting to healthcare services, but they are eligible. They are available for patients who use Medicaid. So you can work with them to find out how to use their state's non-emergency medical transportation services by just simply actually Googling your state's name, as well as NEMT acronym, in order to determine the eligibility, as well as finding out how to apply and acquire a ride through those services. There's also health system-based resources, and these are resources that the health system has to provide for their patients, but they can really be useful in providing transportation to and from appointments. So essentially, both Uber Health and Lyft, Lyft Pass program, they will partner with your health system, whether it's a local office, whether it's a whole hospital network, but the office will create an account with Uber or Lyft, and then it'll be available for the receptionists, the patient intake workers, whoever's scheduling things for the patients at the office. It'll be there on an online platform, just on the website, and they sign in with the Health Networks account, and they schedule a ride for the patient to come directly from where they are living or where they are staying, and getting to the health center for their appointment. And it can be scheduled in advance, so that when the patient's leaving the office from one appointment, they can schedule it for the next appointment, or they can call and have the office schedule it for them over the phone. They're really great resources if your health system has them in place to use for your patients. As well as a provider, you can advocate for these systems to get put in place at your site of employment. And lastly, we touched upon it in our last presentation, but telehealth. Most places now are offering telehealth, especially with the expansion of telehealth with the COVID pandemic. But if your patient, talk with the patient and notify them that telehealth is an option, and if they would prefer to do telehealth appointments because of their transportation needs or other preferences, they can ask the office for a telehealth appointment when they're scheduling, or when they're scheduling online, scheduling their appointments online, they can also request a telehealth appointment typically. But those were the resources, but now I'm going to quickly just walk you through how to use them briefly. They're pretty easy to use, they're user-friendly. The first is just this website that I have linked with state-by-state driving rules. So as you can see, we have a list by state alphabetically of how often licenses have to be renewed, whether you have to retest your driving abilities, and what you should be aware of as a physician practicing in a certain state. The other driving ability assessment resource I had provided in the presentation and in your syllabus is driving tests. It says for seniors, but you can use this for any population. And you will search your state. So if Connecticut's not your state, you'll choose one. Say we're in Delaware. And then you can start diagnostic tests to determine whether your patient is still able to drive physically or cognitively. So those were for assessment, as well as that survey I have in the presentation, as well as in the tools for assessments in your syllabus. But for addressing transportation barriers, what I want to walk through is 211. So 211 is different for every state, but this website is the national website for it, 211.org. And what you can do is you can determine what you need help with and then search by state. So what you can do is find your local 211 and say we're in Connecticut. You search the zip code and then you have your 211 Connecticut resource. And so then we can search for resources online, and you can continue to search for transportation. I need transportation. Say I'm in Farmington, Connecticut, and you're going to search. And you can filter through different types of services, but it'll list the different services. We have local Farmington Dial-A-Ride, and then how to contact them or get to their website. So 211 is really a great resource to find local services. Something similar to 211 is findhelp.org. And again, you'll put in a zip code. And like 211, it provides several different resources, and one being transportation. The difference between 211 and FindHelp is that FindHelp is nationally based, 211 is state-based with that connection on the national platform. But again, you search your zip code, and then you've got paying for transportation resources as well as transportation resources. So you can look for transportation to healthcare, and then it will load up several different transportation programs that you might be eligible for. And lastly, I just want to show you Uber Health. Even though it has to be set up on the healthcare provider side, it's very helpful for patients. Right now, during the COVID pandemic, they're providing rides to vaccines, but they also just provide rides to health offices with the provider's partnership. And so what happens is that the center will set up an account, and then there's a great description of how it works. Here you can book a ride for now or for later, and so the healthcare provider, receptionist, whoever is scheduling the patient's appointment can physically book the ride for the patient to ensure that they can get to the appointment on time. Again, a reminder that Uber Health has to be set up on the healthcare providers or the offices side of things before the patient can benefit from them. So those are our resources. Thank you for listening on transportation barriers, how to address and assess them. And I hope that you can benefit and use these in your future practices.